Yes, welcome everybody. We'll get started in maybe just 1 minute. And thank you for joining us. All right. Well, I think I'm going to get started because we do have a pretty busy presentation here, and I do want to respect everyone's time. So welcome to the webinar about what do patients really think of patient support programs. My name is Lori Prue, and I'm a part-time managing director with the Canadian Arthritis Patient Alliance, or CAPA for short. I'll be co-presenting here today with Linda Wilhelm, who'll take over in just a little bit and will introduce herself at that point. Our plan here is to speak for about 30 to 40 minutes, and then we'll open up things for questions. You're more than welcome to contribute questions and thoughts in the chat. The webinar too, as you've probably noticed as you've come into the Zoom space, will be recorded and uploaded to the CAPA website and YouTube channel if you'd like to share with colleagues and perhaps others who were unable to attend the live session here today. So again, thank you so much for joining us. Now, before I get too much into things, I just like to begin with a land acknowledgement. I'm located on the traditional lands of the Anishinaabe Nation, or the Algonquin peoples, and I'd like to pay my respects to elders both past and present. I'm in a place known as Ottawa, Ontario. We all come from different places, so I just thought you can all take a moment to reflect on the land you live, work, and play on out of respect of the Indigenous peoples where you are located. Also, a brief mention of our disclosures here. So for this project in particular, we received unrestricted funding from the Innovative Medicines Canada. The funder had no role in the design and data collection and analysis and presentation of the results. And all conclusions and expressed, opinions are of the authors or the team that Linda will mention, as well as CAPA. So I thought I'd just get started quickly with the poll. It's not a very complicated poll. It just basically is about, what options sort of best represents your current role. I just thought we can get a sense as to who's here in the audience, who's interested really in this topic. So there's a few different options. I realize I can't capture everybody. I did my best. So we have, you work at a patient support program, you work at a pharmaceutical company, do you provide care to patients in a rheumatology setting? Are you a person with lived experience, a researcher, or are you beyond definition? So I see most people have responded. I'm just gonna wait 5 more seconds just to see who is here in the audience. All right, I don't see much happening, so I'm going to share the results. So as you can see, I don't know if you can see the results or if I need to pull them here. Let me pull them onto the slide. There we go. Hopefully you can see that. So yeah, it seems like we've got a good mix of people here, many that work at patient support programs. So I'm really glad that you're here and are curious about what our survey results found and also what some of our recommendations are. So, all right, thank you so much. And I'm curious about who those there beyond definition are. So I know we don't always neatly fall into buckets. So yeah, just a little bit about Kappa before I get started. So we are a grassroots, patient-driven, and managed organization. Really, this visual here just kind of represents, broadly speaking, access to healthcare and treatments, participation in decision and life activities, and driving patient-oriented research and decisions. Really represents our areas of focus. And so, as you can see, the Patient Support Program project falls under access to healthcare and treatments. We are a patient-driven and managed organization. Our board of directors are all people that live with various forms of arthritis, and we have representatives from coast to coast. And a number of our cross-cutting values include, health equity, community building, right? So we have a wide network of volunteers and individuals that can contribute to our operations beyond the board, as well as partnerships. And really, we see lived experience as expertise, right? And that really goes back to our sort of founding philosophy from over 20 years ago that sees that the person that lives with arthritis is the first expert in the disease or in their health. And so on that, I'll pass it over to Linda.
Sorry about that. I'm just pushing buttons like crazy here. Just 1 second. Okay, I'm Linda Wilhelm, and I am the president of Kappa. I'm one of the founding members back in 2002. And I also live with rheumatoid arthritis for over 40 years, have been a patient with a number of patient support programs. So I think, after going from one to another, there's a few things that we discovered along the way. I also like to thank and acknowledge some of our other contributors, Zal Press from Patient Commando, Don Richards, who's Vice President of Kappa, Linda Roy, who's one of our members at large and does a lot of contributing to our work, Julie McKenna, who's one of our other patient partners under one of our new mentoring program, and Annette McKinnon, another board member from Kappa. So we all kind of got together and kind of got this idea of this project, and it went from there. Next slide. So why did we focus on patient support programs? Well, and they've been around for over 25 years. As far as we know, nobody's ever looked into these programs, and we know that the costs for them are not insignificant. And we're also hearing from our community that people have experienced some issues with their patient support programs. We've also heard that people value the patient support program. So we just thought, well, we should maybe have a look at this. And we heard from our community that, from delays in copay assistance to a lack of awareness around what services are provided, the consent forms, being very difficult to understand and to complete, and just not sure of what the language is very high level, and people struggled with that. So those are just a few of the things we've had that we've heard from our communities, and we thought we should probably have a look at these programs. So, and we wanted to know, how could the patient support programs be designed and delivered to actually provide value to the patients? This money is being spent. Can patients who are in the programs help to maybe improve the programs and identify some of the gaps that are going on there? I know we've done that. We've had a number of focus groups with the biosimilar companies who reached out to us to look at the design of these programs. So we thought it was timely that at 25 years into these programs that we should have a look at them. So, next slide. So when we looked at, one of the questions was, what are the services that the support programs offer, which ones are the most valued. And we found that information about the actual medication use was highly valued, as well as how to take the medication, store the medication, and how to get renewed medication. So they were fairly top on the list of patients, as well as patients value the financial support and the copay support. So those seem to be the ones that kind of floated to the top for patients about how do they navigate and what services are the most important to them. And I'm going to hand it back to Lori for the next couple of slides.
Yeah, sounds good. Yeah, and I guess before I get into some of the details about some of the key themes, at least, that have been identified, I guess I just wanted to make it a little more meaningful and personal. And so, because this really factored into our analysis of the survey results and the recommendations that we'll be speaking to you about shortly. And really, I was imagining a person who, perhaps a young person that lives with a kind of arthritis. In this case, we thought psoriatic arthritis. And frankly, this can be me too, right? I was diagnosed myself with juvenile rheumatoid arthritis when I was 14, right? So this kind of really represented my own experience as I was coming off my parents' benefits plan. You are dealing with this diagnosis and sort of becoming an adult and dealing with the additional stress of an illness on top of everything else that goes on in your 20s, right? This is a time where people are discovering who they are. And so, they're getting, for example, a new job, right? Where benefits often factor into some of these decisions. There might be gaps in benefits, right? And then they're prescribed a new biologic, right? With the PSP. And so how will this person experience the patient support program? And I'd like you to think about this, and I'll try to remind us, I guess, as we progress through the data and the recommendations, and how can we make their experience less stressful and make life easier for them so they can live life the way they want to live it. So, I mean, we had run this survey back in late 2023, had it open for a number of months. We received 375 responses. And so this just provides some of the basic demographic profile of the people who completed the survey. So we had a good representation of different kinds of arthritis or rheumatic conditions. You'll see it won't necessarily add up to 100 because people often live with comorbidities, right? So someone with RA might also live with Sjogren's, right? Or fibromyalgia, for example. So all of these conditions have specialty medications and biologics or targeted synthetic DMARDs that have patient support programs. We had a good mix of people coming from different communities, perhaps a little bit more of an emphasis on people who come from an urban area, for example, some from rural areas. We had a good representation of different provinces and territories as well, and gender diversity with a fairly good split, including people who identify as gender diverse. Also, many of the respondents are of working age, right? They are under the age of 50. Not surprising because we know all these conditions affect people in the prime of their lives, right? And as they're trying to navigate life, maybe parenting responsibilities, work responsibilities, all of these things come into play. So just so you know, the infographics and materials, all of this will be available or is available on our website. So again, let's consider, the 26-year-old who's, being newly prescribed this medication, I guess, too. So some of the themes, one of them was around informed consent. Like I said, let's look at the idea of the 26-year-old who's receiving all this paperwork, has just been prescribed the medication, had a discussion with their rheumatologist, right? And there's a lot going on, right? Someone's health isn't necessarily in the best situation, right? If they're considering taking a new medication in this case. So of the survey respondents who did complete our survey, a good chunk of them did receive a consent form, about 2/3, but it does kind of bear to mind that there's a significant chunk there that did not. And, did they understand the consent form? Well, it's pretty clear here that not all of them did. And I guess when you're considering everything that's going on for this person who is getting onboarded onto a biologic, and it becomes just like a myriad of sort of paperwork that they need to sign off on and not necessarily understand. So that's why the recommendation around strengthening the informed consent process when people are involved, so they're fully aware of the benefits and risks, plain language. I mean, I think we're all guilty of sort of clicking on things, right, in the moment. This happens a lot with websites and with the cookies, for example, that everyone is just sort of clicking because they just need to kind of get on with their lives and get on this medication and start the process. Um, we're thinking that this should be in plainer language, should have a clear opt-out provision. So patients actually realize that they don't have to consent. I think oftentimes you think, well, I'm not going to get access. And I think technically the policies are that you should be able to get access, but this isn't always clear. So that's why we recommend a clear opt-out. And also that they're aware as to how their health data or perhaps their financial data might be used in generating real world evidence, particularly as people are looking to PSPs as a way to generate that real world evidence. Seems to be the big buzzword these days. And so I think it's just really important that patients understand. As well as improving, talking about that data, improving the safeguarding of that data. There was a number of comments about the consent, the use of data, in terms of the free form comments that we received. So, because often people are providing a lot, right? Even just to get on co-payment support and that sort of thing. I know I was subject to, for example, the security breaches earlier this year, right? And so you kind of wonder, well, what information exactly is out in the world and how might it be used against me? This is like concerning when you already have a lot going on in your life. The next key theme or, around the data, around the recommendations is around communication. So again, let's go back to that 26-year-old, are they aware that this separate provider will be helping them, right? Do they know what services are provided and the pharmacy options, for example, the copay assistance? And so we asked a wide range of questions just about those sorts of things. Like, do you understand your pharmacy options? Do you understand what services are provided? And there was definitely some significant gaps there. I mean, when we look at the data, it's just not high enough, right? It's a sizable proportion, I'd say, about 40% are just not aware or satisfied with some of these services. So this is where this recommendation comes from in terms of prioritizing clear, respectful, and consistent communications with patients, ensuring that they're informed of all the different actions. So it's just, being aware of the financial support options in a more clear, transparent way, about the informed consent as well, about, program processes. There's a lot of different phone calls, for example, that come in, right? And, so what's first, second, third, and then when am I actually going to be able to get it? I realize, we're of course subject to whatever the reimbursement process is and that. But even if it's just to provide an update on as to where things are at, I think that would be most helpful, or just to have a bigger view as to what all of these processes are. Many noted they, weren't kept up to date. And I just thought I'd bring in, we had developed 10 years ago, and frankly, this came from the Arthritis Bill of Rights that was created in 2002, was updated about 10 years ago, where we talk about we have an arthritis patient charter. And so I just thought I'd put it in there to ensure that, it respects these 10 key points, having readily available current information, education, and support about arthritis, and to be informed and to be able to participate with healthcare providers in all treatment decisions. And frankly, I mean, the improved communications, can mean less costly mistakes, right? In rheumatology, this would be less joint damage or flares of the disease, right? Which can improve or can have significant effects on their lives, whether that be work, their family, their relationships, or, other aspects of their lives. So that's why we think it's important to sort of keep patients copied on all communications and up to date on any actions taken by PSPs and healthcare professionals. So with that, I'm going to pass it back over to Linda.
Okay, next slide. So patient education, I'm going to leave my camera off because my eyes have been bothering me there, or my arthritis affects my eyes, so it's sometimes hard to see the screen for me. So we often receive inspiring stories about programs or celebrities with the same condition who are doing great and managing great. But it actually isn't a comparison given these individuals are from a higher class in society and live with some kind of privilege. So this was a quote from one of our youth responders. So one of the recommendations that we have, and this one's for government, that government actually provide funding to patient organizations to provide education about these patient support programs, what their role is, what services they provide, and the financial support that's available. Most patients, you don't even know there's financial support. We've talked to many patients that we, hear from that don't realize that they could ask for help with their copay, and they struggle every month to try to make that copayment. So, and then to support patients to navigate the patient support programs and support the health, and then the education should be delivered accessibly. So people, no matter whether if they're online, live in a rural area, in a city, that they can access the education they need about these programs in a manner that works for them. So again, with our survey results, and 38% thought that the financial assistance available was important. 31 is the other types of support that are available. And I can tell for personally, my rheumatologist, I retired a number of years ago, and my new rheumatologist was very young, and she had 3 children in 5 years. So she was out on mat leave for probably 3 out of 5 years, and it was the patient support program that actually became that linkage to my rheumatologist office, because she wasn't there, but her admin still worked 2 or 3 days a week. And I would email or talk to the support program. They would reach out to my rheumatologist office, and that's how I got rheumatology care for a good part of 5-year period that she was out. And it was, unfortunately my health was stable and I was doing well, so it worked out really well for me. So again, these programs have filled a gap in the healthcare system that many of our patients need. It's too bad that all the patients with rheumatoid or inflammatory arthritis don't have some kind of program that can support them in this manner. So next slide. So another recommendation is the insurance system. So, I mean, initially, I think that's why the programs came into being. I started on a biologic in 1999 before they were approved under a special access program. But once they were approved, they were very, very expensive drugs that society really hadn't seen the cost of drugs like these either before some of the other expensive cancer drugs came to be. So the patients, we knew our patients were going to have trouble trying to get coverage through these for their insurer. So these programs initially, I think, came into being to help patients navigate that insurance process. But that's complicated. The processes, they're They change, they're different for every company. Navigate the co-pays. There's always prior authorization. And I can tell you again, personally, I've had my prior authorization not renewed from time to time. I showed up at the pharmacy to pick up my prescription. Oh, you haven't got your special authorization through yet. But had I been copied in the communication, I might have known that previously and maybe could have called my rheumatologist and done something to facilitate that approval process. Because I can tell you, it is really disconcerting when you get to the pharmacy to pick up your prescription and you're said, oh, that'll be $1,635 because they haven't put your authorization through. So I can tell you that's one of the experiences I've had, and not just once. And then to reduce the barriers for patients to timely access. And that's the other issue that we found. When you're switching from one biologic to another, you're already not feeling well, which is why you're switching in the first place. And then you got to try to navigate a whole new patient support program that may or may not operate differently. I know I can tell you again, sometimes it's taken 2-3 months to navigate the change process. And in the meantime, you're delayed getting onto the new medication. Your life is on hold because your disease is flaring. The other thing is to engage patients meaningful in the redesign of reimbursement processes. Copay structures, prior authorizations, again, include patients in the communication. We'd love to develop processes that meet the needs of patients and reflect the range that we have of lived experience. So, really do we need to start working on these programs with patients, and even for development of the administration of a needle. There's I know that my biologic and the one before it has this wonderful spring-loaded syringe. Unfortunately, I can't push the syringe down, and nobody's ever listened to me about this issue. And I know I can't be the only one, because when people start a biologic, they're not doing well. Their hands are sore, and they give them this syringe that they can't even use. So, that's just another simple thing where you're not co-designing and not listening to patients. Things are not going to work well for patients. So, next slide. So independent monitoring, I think that's kind of where we're getting at from why we did this survey is, all significant amount of money is being spent on this program, but nobody knows how well it's working or if it's even meeting the needs of patients. So, we need to for government to provide some support to patient groups to look at these services like we've done. As CAPA, as an organization, a patient-driven organization, we this was important enough that we got funding to start this initially. It's not where we want to stop. We'd like to continue to work and try to improve these programs so that no patient falls through the cracks, and that there is regular independent evaluations, sharing the results with industry, who I think would be really interested to know how their programs are meeting the needs of patients with the money they're spending. Also, a mechanism for review by a community of patients that use these services, because we're the ones that are most affected by, the services don't meet our needs. We're the ones that end up with delays in getting access to our medications. And it will support accountability and transparency and a continuous improvement and a focus on the patient experience. So, it's all really important, and we want to see that these programs do what were intended to do and help them people most need it. Next slide. And then patient engagement. Again, we can't really say enough about this. To co-design these programs with the patient communities, including those that are diverse, people who live in rural and remote communities. And it should extend to all stages of pharmaceutical development, right? From the drug discovery to right through to the program delivery. A national council for patient support programs that, it's from multiple disease groups. It's not just people with rheumatic diseases that use these programs. Joint leadership from patients and industry, and it would oversee the effectiveness and promote the sharing of best practices, explore the use of patient data, ensure that the programs remain patient-centered and relevant to those they serve. So it puts the patient in the center of all the communications. And that's, I think, essentially what we're after. So it's pretty frustrating as a patient when you know you can, help to get some of the barriers and alleviate some of the barriers, but you have no voice. And I said, even just a simple example of the syringe that, these syringes have been used. I've been using the same one for 15 years and can get nobody to listen to me about the fact that it's not working for people who have sore hands. So next, I think that's turn it back to Lori. I notice there's a number of questions in the chat, Lori, too.
Yeah, sorry, I just realized I was muted, but yeah, no, that we're pretty much just at the question period. I know we're about 30 minutes in, so we wanted to have some time to answer questions. So, I mean, the first one, I'm just going to go in the order for which they were asked, but feel free, we can kind of. Also, you can have the ability to just lift up your hand if you want to ask it in real time. This is not like a constrained Zoom meeting or that sort of thing. So feel free to do that as well. But in terms of some of the questions, the first one I see here was just what was the process for patient recruitment? That came from, is it Gitika earlier in the presentation? And so basically this was like a survey monkey survey, and we opened it up to our community. So sent that out through our newsletter, for example, shared that with our community of volunteers as well as we work collaboratively with a lot of other patient organizations. So for example, Natasha Trahan here is on the recording. So I think Natasha had shared through Take a Pain Check Foundation, which is an organization by and for youth, and other organizations. So that's pretty much how we recruited people and asked for them to complete the survey. So. There was a small incentive provided because I think people, frankly, like to see that you are going to use their feedback, because there's a lot of requests out there, right, to do surveys and that sort of thing. So I mean, researchers do this all the time, and so we entered people's names into a draw for a couple of gift cards and that sort of thing. So that was basically the recruitment process, which I think in a way answers the next question from Allison around how many patients who could have responded, how many did you invite? I mean, it wasn't, we don't have access to the roster of people enrolled in the patient support program, but we are connected to patients, right? So the recruitment process, had a different flavor to it than I think the typical evaluations that are done within patient support programs, at least to my knowledge. I think there was a question here too for you, Linda. Hi, Linda. This is from Chenille. When moving from one PSP to another, is it common to switch between PSP vendors? Are your health data transferred to the new PSP from the previous? So.
I don't believe the health data from the previous one is transferred to the next one. It's like, yeah, and that was one of the things I said many, many years ago as well, as there was no recognition. Okay, I've already been on another biologic with a patient support program for 5 years, and then I switched to another one, and then it's like starting like you've never been on a biologic ever before in your life, so they want to come out and train you on how to self-inject. Well, no, I don't need that. I've been self-injecting for 10 years already. Or they, all you really need at that point is to get the paperwork in, get the process going so that you can start your new medication and start to feel better and hope the new medication works better than the old medication, which there's never any guarantee, right? So it's really a scary time when you're switching. And one of the things that the patient support programs need to do better with and need to do well is to facilitate this switch quickly, efficiently, so that patients can get onto the new medication. And that may even, I mean, it's not happened in my case. I have heard of other patient support program, other medications where the patient started on the medication, then the paperwork goes in. So the patient's not the one waiting to get approval before they start the medication. That actually, you should be starting the medication, then get the paperwork through or whatever. That it should not be delaying the person starting. And forget it if it's summertime, because the one time I switched, it was summertime, and the person who was supposed to do it was on holidays. Nobody else could do it, so it delayed it for an additional 2 weeks till the person got back from holidays. So there are a whole lot of issues with switching, and I think we need to make it as efficient and quick as possible.
Yeah. No, and that was sort of backed up with some of our survey. We did ask people, and a lot of people, about 50, I didn't cover that in as much detail because I wanted to kind of cover the main highlights of things, but they did mention, I think half of the respondents had experience switching, either because of the biosimilar policies or just because they need to try, a new medication, and that the transition wasn't always easy and seamless, right? Like even myself, prior to biosimilars even coming about, like I've been on 3 patient support programs. So switching is always a bit of a big deal as you're not feeling well. So I think it's important to see what we can do to literally ease their pain, both figuratively and physically, because it's a really rough time for people, right? When they're going through this. And I think Natasha here in the chat is saying that, something about finds it upsetting that patients have to prove to the programs that they can't inject themselves due to pain. Anyway, so she's done some similar advocacy around that. I know, in terms of the design of the syringes, Linda, which I think you touched on. So, um, So I guess the next question I see here in the chat is, were any of your findings impacted by disease severity? This is from Jose Brisbois. And we didn't actually, like, this is some of the limitations, right, of a survey. Like, we just wanted to get a broad sense as to what people thought. So we only captured data on the kind of rheumatic condition that people had. I can only guess that if people have advanced to advanced therapies, right, which is where a lot of these specialty pharmaceuticals come in, that their disease severity is probably pretty high. It would be my assumption, or what I might, throw in there. So we're not kind of talking about people with milder disease. I don't know if Linda, you have anything else to
Yeah,
add?
no, I mean, but there's criteria involved, and we hear about it all the time. People have to fail on all the other treatments before they can even be eligible for a biologic. So very few people who don't have advanced, and serious aggressive forms of the disease would get on a biologic. So I think we can safely assume these are people with moderate to severe disease. So.
Yeah, I think so. Um, yeah, and then a question here from Natasha about, do we have any advice to new patients that are starting a patient support program? I don't know if Linda, if you have any, I mean,
Yeah, I mean, one of the things is that to bug them. I mean, for me, that's what I've had to do because, like I say, people being on vacation or not getting the forms done. So I think I'm probably the annoying patient that will call my rheumatologist. Has everything gone through? And then once it's gone through, I get the name of the person who's going to be my link with the patient support program, and then I'll immediately reach out to them and say, how, is everything going through okay? Have you sent it in? in? Can you give, because I know in my province of New Brunswick, once they receive a special authorization, once my drug program receives that special authorization, it usually only takes a week or week and a half for them to approve it. So the delay, is not on the government side. And I think lots of times I've been told, well, the government's delaying it, or the doctor's delaying it, or the pharmacy, that's the other one. The pharmacy's delaying it. So that's why it's so important when we talk about communication, because you have the pharmacy, you have the patient support program, you have the rheumatologist, you have, the payer, the drug program, and the patient. And with all these people that need to communicate, if you don't include the patient in these communications, the ball, how could it not get dropped when you have that many players involved in an approval? So absolutely, for me, I will keep at them until I actually get the drug in my hand. So that's the only advice I can give to them.
Yeah, I know. And I would very much second that, right? And I've made many calls over the years, right? Because I've been on biologics, or ended up having to kind of manage them even through pregnancies and that sort of thing. So it's really, kind of up to you, unfortunately. Like that's why we're emphasizing the communication so much, because it's a way to like simplify our lives at the end of the day, so that you could see if you need to, make a call to someone, right? And see if you can try to, unloosen the bottlenecks that can come into play very quickly, because there's nobody that has more at stake than patients, really, at the end of the day. So I think that's why, these are our lives, right? A lot of people can't front the money to pay for these medications independently. Like they need support, and that through this process. So anyways, all that being said, really important to engage patients on an individual level and support them, And then there is another question here from Guillaume Lefebvre. Bienvenue, Guillaume. It's been a while. I have a lot of recommendations, or he sees a lot of recommendations for governments. Have you shared the results with the provinces, and what was their reaction? No, really good question. And we've tried to make sure that there's like a broad set, there's recommendations for different interest holder at the end of the day, because I think, governments do play an important role. I did present this as a poster, and maybe that's where some of you have learned about this project at the Canada's Drug Agency Symposium earlier in September. So I think a lot of listening from what I can gather on the part of government, but we would like to follow up and perhaps share a copy of this webinar with the different interest holders, which would include funders, or payers rather, the people who fund our medications, and subject to that, just to raise awareness as to some of the issues here, because I think it's generally been, as Linda said in the beginning, we've had these for a very long time, and we haven't really re-examined, how or why they exist, and how they fit into our healthcare system. So anyways, so we'll be doing that over the coming months, so anyways, and then there's just a comment here from Natasha. I don't know if I think we're through all of the regular questions, unless there's somebody that I've missed. Like I said, feel free to let me know. You're more than welcome to put your hand up, and I can bring you on as well if you have a question you wish to ask.
And then we're also talking, we've got our strategic planning meetings that we've been having. We had one, and we have another one coming up, where we're looking at what we're going to do next, and what our next steps is in this project. So we're talking to researchers, and I don't, hoping to get a little bit more attention on government, because really for many other diseases, these are all part of there's the disease, the the government program, the healthcare system, right? They, people with diabetes, they go for needle education, and people with cancer, they have patient navigators that help them navigate the payer system for their medications. And we've never had any of those services within our disease community. So this is, I think, why the patient support programs came to being, was to fill that gap that was not happening. Because initially they wouldn't even cover the biologics if you got an infusion in a hospital setting. That they had to set up separate infusion clinics, right? So that's back 20 25 years ago, and that's no longer the case now. But yeah, so what we're looking at next steps and what's next for this project.
Yeah. Yeah, and we continue. I mean, we're involved in sort of broader, advocacy just to raise awareness of the impact of arthritis, right? Not an old person's disease was probably the thing I repeated the most at last week's lobby day, as I explained that I got this disease at age 14, right? That I'm, one of 25,000 kids in Canada that live with this illness, right? Or, like part of that broader community. I'm not a child anymore, but I still have juvenile rheumatoid arthritis, right? And suffer the long-term consequences from that. So,
Yeah.
anyway,
Myself, I was 20 when I got rheumatoid arthritis. So, certainly still not a child, but not very old. And it certainly
yeah,
been when I was having kids, and it was a huge, made a huge change in my life. So
yeah, for sure. Well, I might do one more, request for any final questions. We don't have to go until 2 o'clock. That's just a time that was slotted for things. So if there are no more questions, we'll sort of proceed. Just a comment here in the chat from Guillaume, just thanks from others, and about thank you for sharing. It was a really informative webinar and that sort of thing. Will, make a copy of this available on our website and share in our newsletter. I would highly recommend, we would really appreciate if you would follow us, because you keep up to date. We send out a monthly newsletter about all of our activities that we do, including this. We have some of the infographics available on our website, and we're always happy to talk about this topic more and to, bring or shed light on this topic that really hasn't been discussed for any length of time. So, if, I think I put the website on the slides, but I'll put them in the chat as well if you'd like. Oh, thank you, Anna. I'll put it in the chat, or Anna's put it in the chat if you want to subscribe. We're on all social media as well. And I'll be sure to send a copy of the recording once it's uploaded to everybody that registered, that you all have. So please stay tuned for that over the coming weeks. All right. So
thank you, everyone.
yeah, thank you.